Our panel to discuss: Art Laffer is a former economic advisor for President Reagan. Seth Harris is a former acting Secretary of Labor under President Obama. Art, let's start with you. You've gotten a chance to look at this bill. In your opinion, what does it do to the American economy?
Well, I think this bill would be very good for the American economy. I disagree with Warren Buffett. I mean, whenever you have a limited supply of something like health care, whenever you put in subsidies, it raises prices. I mean, you can't get more of the health care. Now, it does change the distribution of health care away from those who have it now and those who didn't have it. Those who didn't have it will get more of it. That's true. But the one thing that bothers me, and I do like in this bill, is insurance is not health care. And when you require the medical community to fill in forms and do all sorts of other bureaucratic things, that does reduce the availability of resources to actually serving patients in the totality of the economy. So those are the issues I think we have to face.
Seth, healthcare is responsible for a huge portion of the American economy, millions of jobs. So are fewer federal dollars going to end up costing jobs?
No question about it. The healthcare industry has been really surprising. For 25 years, in good times and bad, Republicans and Democrats in office, the healthcare industry has grown jobs very consistently. But what this bill will do, what the House bill and the Senate bill would do, is pull hundreds of billions of dollars in financing out of the healthcare industry. That means that a lot of people who need care won't be able to afford care. A lot of people who need insurance won't be able to get insurance. So it's possible that some portion of that money will be made up by states or by working families borrowing against their houses or running up their credit card debt. But we're going to lose hundreds of billions of dollars in investment in health care, and that means that one of the most reliable job engines in our economy is going to be stumbling.
Back to you, Art. Republicans are seemingly disagreeing about whether or not this thing is going to bring down premiums. You heard what Health and Human Service Secretary Tom Price had to say. I want you to listen to what Rand Paul said earlier today on ABC.
The plan in its entirety will absolutely bring premiums down because you increase competition, you increase choices for individuals, you allow folks to be able to purchase the kind of coverage that they want, not that the government forces them to buy. Those are all the secret keys to a market that actually works for healthcare and works for patients. That's the key.
They've promised too much. They say they're going to fix health care and premiums are going to go down. There's no way the Republican bill brings down premiums. Look, I've been in medicine 20 years. I'm 54 years old. Premiums have never gone down. They're not going to go down after the Republican bill. And it's a false sort of over-promising to say, oh, yeah, insurance premiums are going to go down, but we're keeping 10 of the 12 mandates that cause the prices to go up. It's a foolish notion to promise something you can't provide.
Art, is Tom Price promising something that he can't provide?
I don't think so. I think Rand Paul is correct about the history of premiums going up. That's very true. But getting rid of just two of those things that have caused premiums to rise will be better than not getting rid of any. I mean, it's a very simple thing. Healthcare industry, insurance companies, and hospitals have done very, very well in the last few years, and especially under Obamacare. I was chairman of the board of Centennial Hospital here in Nashville, which is the flagship for HCA. And I can tell you there are lots of ways of bringing competition back in. Just transparency, just knowing what you're paying for the medical services you get. No one knows that. No one knows the quality of the medical services. They don't have any quality. Those would be really easy to make the markets far more competitive and make them respond to consumers. But that's not it. Doctors don't even know what the costs of some of these procedures are. They just tell you to get them, and that's it. And that's not a good system. It really isn't, and it doesn't lead to control over costs. That's for sure.
Seth, Democrats, let's say, haven't been shy to express their feelings over this proposed bill. I want you to listen to Senator Chuck Schumer.
The president said the Senate bill needed heart. The way this bill cuts health care is heartless. The president said the House bill was mean. The Senate bill may be meaner. The Senate Republican health care bill is a wolf in sheep's clothing. Only this wolf has even sharper teeth than the House bill.
Hillary Clinton also tweeted out when the bill came out, saying that if this passes, it makes the Republican Party a death party. Is all that Democrats can do at this point rhetorical? In other words, is there any strategy for them to try to shoot this thing down other than just talking about it?
Well, I think what they have to do is point out that this is not really a health care bill. And let me say, I'm so delighted that Professor Laffer is in this discussion. He is the godfather of supply-side economics in America, and I say that with all due respect, but that is a philosophy that says cut taxes for the wealthy and you're going to help everybody. It hasn't worked. That's precisely what this bill does. It gives billions and billions and billions of dollars in tax cuts to the wealthiest people in our society and cuts that money out of health insurance and health care for poor people, working class people, and middle class people. In the process, it's going to devastate industries like nursing care, opioid addiction treatment in the United States. Rural hospitals are going to get slammed by this bill. Many of them are going to have to close. So as Democrats fight this bill, and I hope they will vigorously fight this bill, they need to point out that this is a tax cut bill for the wealthy that is going to do devastating damage to middle class communities around America.
Art, he mentioned you by name. I have to give you a chance to respond.
Did. Well, I think he's wrong. Okay, I think we did pretty well with Reagan. I think Kennedy did pretty well. I think Bill Clinton did pretty well. Those were all supply-side administrations. What he doesn't realize, and what is really important here is Seth doesn't realize that there are a fixed amount of medical resources. And if you give one group medical resources, and I don't disagree with that, by the way, Boris, I really don't. Just remember, you're going to take them away from someone else as well. It's a fixed amount there, and you're going to push prices up. That's just simple economics. As Larry Gatlin says, Seth, it ain't rocket surgery.
Art Laffer, Seth Harris, we'll have to leave it at that. Thank you, gentlemen, so much. Appreciate your time.
Thank you.